Okay, today I'm going to be showing you how to put on a PPE. So the first thing you're going to do is you're going to assess the patient and check patient history and verify that the doctor has ordered isolation. And then after that, you're going to gather the necessary equipment and you're going to perform hand hygiene, put an adequate amount of sanitizer on your hands, and then rub until the hand sanitizer or alcohol-based disinfectant is dry. You're going to get under the nails. And then just keep rubbing. Okay, then once the hand sanitizer is dry, you're going to put on a gown, which I don't have, but you would put it on, cinch it at the waist and neck. You would put on another one, one facing forward, the top one facing back if the gowns were too small. And then you're going to put on a mask. Make sure it's secure. And then goggles. And then gloves. Okay, so I have surgical gloves here. They're latex. You would put on some non-latex gloves if your patient was allergic to latex. These ones are a little tight on me, but they're good. These are surgical gloves, so obviously they're going to cover the edges of the gown, but if not, pull the gloves forward to cover the edges of the gown. You're going to go in and you're going to talk to the patient. You're going to get 2 forms of ID, a name and a date of birth, and you're going to perform whatever action you came in to do. Make sure that they're not depressed because patients under isolation can get depressed. And then you're going to step out of the room, close the door if they're under airborne precautions, and then you're going to take off your goggles first. And then you're going to take off your gown, being careful not to touch the outside so that you don't get contaminated. And then you'll take off your gloves. First glove, just peel off. Don't touch your hand. Then you're going to crunch it up in your hand and slide a finger underneath the second glove and bring it forward so that you don't touch the outside. And then you'll take off your mask. You'll dispose of the mask, gloves, and the gown appropriately. Perform hand hygiene again. And after you're done with that, you're going to log what you did in the patient's room on their chart.